Welcome to the Teeth Chatters podcast, where we chat all about the correlation between oral health and systemic health. My name is Sarah Giuliano. I have been a registered dental hygienist for over a decade. Now I'm about to branch out from the dental chair into the community to all you beautiful, amazing people. Together, we can connect the body to the mouth through educational podcasts. So let's get this show started. So today's going to be a little bit of a different topic. I've been kind of struggling and pondering this topic discussion for the past few weeks and trying to put a lot of thought, what do I want to talk about? I took a couple deep breaths a couple weeks ago and said to myself, all right, Sarah, let's talk about the largest systemic health crisis that has impacted our world for the past year and a half. Let's talk about COVID-19. Today, my mission is to help people become more educated on the science behind this virus and how it's impacted everyone in the world in some form or another. Gaining knowledge and becoming more aware, the more we're aware, the better we are and the better our lives will be. So, after careful and thorough research, I've expanded my knowledge on the COVID-19 virus, and I'd like to share this information I have gained today with all you lovely listeners. So thank you for tuning in. I want to bring my guest on the show today. This is someone that I had met a few years ago. Her name is Maggie. And about a year and a half ago, Maggie actually had the COVID-19 virus. And I wanted to bring her on because I wanted to have somebody here that actually could really share with us how COVID-19 has impacted her. So Maggie, hi, how are you?
Good, how have you been?
I'm doing well, I'm hanging in there.
Yeah, that's great.
How's your fall?
It's so far so good.
I know, it's been beautiful, hasn't it?
Yes.
So are you ready to talk about this?
I am very excited to talk about this and just learn more about the science behind it.
Yeah.
And, your perspective on it as well.
Sure. So today I think it's really interesting, we'll talk about COVID-19, but we're also going to talk about some of the symptoms that you get with COVID-19 and how it's related to your oral health. So obviously you had COVID. So,
Yes.
Tell me a little bit about that. So it was a while ago.
Yeah, it was about a year ago. But like you said, I think that some of the symptoms are so relevant to your oral health, like your loss of taste and your loss of smell and dry mouth.
Did you have that?
I did.
Wow.
All three.
Aw.
Everything
I'm
in your head is connected.
Right.
So I think it's really important to dive deeper into that because...
Right. And understand why.
Exactly.
Right, because we all, I know everybody was like, oh my gosh, I lost taste and I lost smell and, what if I have COVID? But why?
Exactly.
So that's really what I was researching, and I'm so glad that you're here because I knew you had questions. I ran into you a couple weeks ago, and you had told me about this, and I'm like, you know what? I'm going to bring Maggie on the show because she can actually bring this, information to us as well, too. So those of us that are out here that haven't had COVID-19, thank God, and some of us that did have COVID-19, I'm sorry. But I really think it's important to understand why and how these symptoms progress. So, you ready to get started?
Yeah.
Okay.
Let's get going.
So, as the pandemic continues to keep its presence and remain relevant in our world, researchers are discovering more information about the progression of the COVID-19 virus and its connection to this enzyme receptor that's in our mouth, it's in our saliva. And of course, this podcast is all about oral and systemic health. We know this. I always like to bridge that gap. There's a huge bridge here when it comes to the COVID-19 virus. Did you know that?
Well, I'm going to find out more about it.
Are you excited?
I'm ready to nerd out with you.
Okay, good. Nerd out with me because like I said, this topic is not going to be... It's going to be a little bit tough today, guys, so please just hang in there because I really want to get this information out here. It may get a little boring at times. I'm sorry, but I really want to address as much as I have learned, and I want to share it with you guys. So, as most of you know, your mouth is the first line of defense against foreign bacteria, viruses, and overall infections. Saliva has one of the most difficult roles in the body. Not only does it protect the body as a first line of defense, but it also has to fight off all the foreign microorganisms that enter your mouth, aka COVID-19. And it has to protect all of your oral tissue from traumas, burns, lesions. I mean, saliva has a lot of pressure on it.
Yeah, and especially considering everything that you put into your mouth daily between food and drink and, just, the cap of your water bottle.
Exactly.
It's crazy.
Your fingers.
Exactly.
How many people chew on their fingernails? Think about that. And your mouth is constantly trying to fight off every single foreign organism that comes into your mouth.
And it happens daily. This isn't just, it's, just viruses. It happens daily.
And we do it subconsciously. We don't even think about that we're doing it. So what I want to do today, saliva has so many awesome, cool functions. I love to totally nerd out about anything that comes to do with the mouth. But today we're just going to talk about a couple of very relevant functions of saliva that actually pertain to the COVID-19 virus. So first, let's just talk about this. You ready?
Yeah, let's do it.
So a normal, healthy salivary flow in a normal, functioning, healthy body, your body will produce 600 milliliters of saliva per day. That's a lot. Do you know many ounces that is?
That's kind of crazy to think about. That's 30 ounces of saliva.
Think about 30 ounces. That's a lot.
Yeah, and if you think about it, a typical bottle of water you would buy is probably about 16.
Right.
So that's almost 2 of those.
Right.
That's crazy.
So, and the reason why your body's producing so much saliva is because why? It's that first line of defense. It's that protective barrier. It needs a substantial amount of saliva to protect you from microorganisms. So that's one of the cool functions. We need to remember this. This is another one. We have these cells called Astiner cells.
What are those?
So what they do is they secrete either serous cells or mucinous cells. So these cells are also going to be relevant when we speak about the COVID-19 virus. So these serous cells contain proteins, antimicrobial agents, as well as stimulating enzymes. That's the serous cells. Those are the ones that have like the antibodies, the proteins, the enzymes that break down food, the ones that fight off the bacterium. The mucinous cells just help lubricate and keep the oral cavity moist. It does also contain hyaluronic acid, which is super important just to maintain that normal, moist oral cavity.
Yeah, so those are definitely important because, as you know,
right,
a moist mouth all day is essential for anything.
Sure.
And especially if they work together to fight off those first line of foreign bacteria and diseases,
right.
That's obviously very important for the oral cavity.
And again, do we think about this? Not at all. We just know our body's naturally producing something. We don't think about it all day, but that's why I'm trying to bring this to the forefront. It is important so we know. So if we do have an alteration, and let's say our mouth is super dry for a couple of days or so, it needs to be addressed.
Definitely.
It means something's going on in your body, and your body's having a tough time producing the saliva and being that first line of defense. So those are 2 major things. So let's go into another one. So again, we have these awesome antimicrobial activities. Saliva flushes invading pathogens from the oral cavity. Invading pathogens, also known, we're going to talk about COVID-19. So what they do is they contain an arsenal of anti-inflammatory proteins, and they disrupt the integrity of these microorganisms that are foreign that enter the oral cavity.
Such as COVID.
Such as COVID, right. It also has these awesome histidines, which is found in your saliva. This other one very relevant part that I want to talk about, and then we will get off the topic of saliva a bit, because I don't want to lose my listeners. We have a salivating, stimulating taste bud receptor called tastent. Tastent is activated in the gustatory gland complex. Stay with me here, Maggie. So what that does is once this tastent stimulating taste bud receptor is mixed with your saliva, it activates taste. It activates your taste buds. This is also going to be relevant when we start talking about COVID-19, because what are some of the main symptoms that people get with COVID?
Yeah, I was going to say, I'm sure we'll come back to this just because loss of taste is such a big symptom with COVID.
It is. And I've heard people, and I don't know about you, but that have said, I had COVID a year ago, And I still haven't fully gotten my taste back.
Definitely, yeah. And also, it's affected the way some foods taste. You know, I remember them prior to COVID. They don't taste the same to me now.
So when you had COVID, before we get a little bit further, when you did have COVID, did you notice, like, when you did eat, did everything taste differently?
It was weird. You just kind of, the first time I noticed it, I went to bite into an everything bagel, which should be a very flavorful thing.
Right.
And it just tasted like nothing.
Aww. And you had that for a while?
Yeah. And as it started to come back, you know, you can taste the spicier foods or the foods with more flavors. But some things just never really returned for me.
I'm sorry. I'm sorry.
Hopefully someday.
That's like one of our favorite things to do is eat.
I know.
And taste our food.
Really
it's like
disrupts it.
I know. It's like one of our greatest pleasures in life. Okay, so we're going to get into one more really cool thing. This is the very most important part of this podcast that I want everybody to kind of tune in with me. So stay with me, guys. So this really last awesome part of saliva that I want to talk about is it contains this enzyme called an ACE2 receptor.
Sarah, I'm going to have to stop you. What is an ACE2 receptor?
Don't fall asleep on me, Maggie. Okay, everybody, bear with me. So this is going to be the biggest connector that we're going to talk about today between your saliva and COVID. This is the toxic bond right here, this ACE2 receptor, which naturally is not a toxic bond. COVID's bonding to it, so we're going to call it toxic.
So it becomes toxic.
Sure it does. ACE2 is healthy, COVID is not.
Gotcha.
It makes it toxic.
Makes sense.
So, have you ever heard of an ACE2 enzyme?
I have not. I can honestly say I'm not sure what an ACE2 enzyme is.
I'm probably going to say that most people that don't have medical background probably have never heard it. So here we are. We're going to address it. So ACE2 enzyme is called an angiotensin converting enzyme. This enzyme is highly abundant in all epithelial tissue lining throughout the body. So your epithelial tissue lining in the body would be like your arterial walls, your blood vessel walls, the lining of your lungs, your kidneys, the lining of your nasal passages, lining of your brain, lining of your gastrointestinal tract, your liver, most relevant to this topic, your oral cavity. So these ACE2 enzymes are super prevalent and abundant in your cheeks, lining of your cheeks, on your tongue, in your salivary glands.
So they are basically everywhere in your body.
They are. And what they do is they're phenomenal when they're functioning normally. So what they do, so an ACE2 converting enzyme is a very vital aminopeptide. So aminopeptides are like these long chains of amino acids that act as messengers. Okay, so this ACE2 enzyme is like a messenger that involves the process of maintaining biochemical pathways that are critical in regulating this renin, angiotensin, aldosterone system. Stay with me.
And what is that? And how does that function in the body?
So, renin, angiotensin, aldosterone system, aka RAAS.
A lot easier to say.
A lot easier to say. So it functions, its main function. So what it does, it elevates blood volume and arterial pressure for prolonged periods of time. So this ACE2 angiotensin enzyme will convert angiotensin 1 to angiotensin 2. So it does. It plays a very critical role in maintaining communication and biochemical pathways to maintain homeostasis in the body for your systemic blood pressure, for your vascular resistance, your electrolyte balances, your fluid balances in your kidneys and your body. So it aids in wound healing, especially in blood vessels, arterial walls, and your epithelial tissue lining.
Basically, overall, just maintaining a healthy balance in your body.
Yes, healthy blood pressure levels.
Yeah.
Right? So angiotensin 1 brings it up, and the converting enzyme, this ACE2 enzyme, converts the angiotensin 2, brings it down, helps regulate that homeostasis in the body. So this ACE2 also contains amazing anti-inflammatory properties, and this reduces inflammation from pathogens, aka COVID-19, anywhere the body has ACE2 receptors. Now, getting back to where we were, remember how I said they're very highly prevalent in the mouth?
Yes.
These ACE2 enzymes. Okay. Are you with me?
I am.
You're following me. This is great. I love this because I'm so nerding out right now and you're still awake.
You are a nerd, that's for sure.
But a fun one. So most viruses, infections, foreign bacteria enter the body through the oral cavity, the eyes, the nasal passages, and most of these pathogens enter directly through salivary communication and airborne droplets, okay? These foreign bodies are latching and attaching to the epithelial lining, and what happens is that's how they get in and connect into your body.
And then once they latch, is this how they're transported through the body?
Yes. Go,
so the
Maggie,
mouth
you
is
got it.
The gateway
you get a gold
to
star.
everything.
Your mouth is a gateway. In my personal opinion, I truly believe your mouth is the mirror to the rest of your body. Keep your mouth clean. Less foreign pathogens to the body. As we all know, one symptom of COVID-19 is the loss of smell and taste. What if you knew there was a product that could alleviate the symptoms of altered taste? Medikill is a first-of-its-kind product to alleviate metallic and altered taste symptoms. Medikill has a unique scientifically developed formula that contains xylitol and essential oils. All ingredients are generally recognized as safe by the FDA. Medikill is an oral rinse with a mild mint flavor designed to cool your mouth and alleviate taste alterations. It's quite simple. Just rinse for 30 seconds, spit out, and get immediate symptomatic relief. Teeth Chatters listeners can receive 30% off their purchase with the coupon code PODCAST. Go to Medikill.com to purchase Medikill and restore your taste today. Once again, that's Medikill.com, code PODCAST, to get 30% off your Medikill order. Get rid of your metallic taste today.
How does saliva and ACE2 enzymes correlate to the COVID virus?
Thank you for asking. Here we are bridging the gap now. So we talked about this saliva. We talked about this ACE2 enzyme and its function. Now we're going to bridge that gap and how COVID is here. Studies have indicated that the COVID-19 virus is attaching to these ACE2 receptor enzymes. This attachment initiates viral activation, leading to the onset of the COVID-19 virus to enter the mouth. Then what happens is it moves systemically wherever there are a high prevalence of these ACE2 receptors in the body. Remember we talked about they're everywhere. So what happens is they're getting into the oral cavity. They're latching on, right, to this epithelial lining. So what happens is they're migrating through tissue migration and blood serum levels, and they're attaching to all these vital organs, and they're creating dysregulation and inflammation to all these vital organs. The lungs, the heart, the brain, the kidneys, the liver.
So it's essentially throwing off your body's homeostasis.
Yes.
And it's causing these ACE2 receptors to not be functional anymore.
Right, because the COVID-19 virus is latching onto them. The ACE2 receptors are no longer able to function properly.
Exactly. And when those spread throughout your body, it throws off your balance.
Throws off your homeostasis. Yeah. Right, so your fluid balance, your electrolyte balance, your blood pressure, your blood arterial pressure, vascular resistance. I mean, this is huge. And this is unfortunately why COVID-19 has done so much destruction.
Yeah,
it's really sad. So an alteration in these ACE2 receptors, or the dysfunction of these ACE2 receptor levels, will create an imbalance in this retin angiotensin aldosterone system. Remember that RAAS system?
How could I forget?
You're going to be saying that in your sleep tonight. So this can alter blood pressure levels, renal functions in the kidneys, pulmonary arterial pressure in the lungs. Where is COVID most destructive? the lungs.
Definitely.
Right, because your lungs are very close to your mouth, right?
And I know, breathing problems have become huge with COVID, especially a lot of people experiencing those long-term effects.
Because they're already systemically immunocompromised. They've already have issues with these vital organs. You tack this virus on, it just creates and generates more inflammation to these areas. So a dysfunction into these ACE2 enzymes disrupt normal anti-inflammatory process for these ACE2 enzymes. And when there's a disruption of these ACE2 receptors, this enzyme becomes a pro-inflammatory. So it kind of turns on itself because COVID's overtaking it. It's latched onto it. So this will increase systemic inflammation anywhere these ACE2 receptors are, like I said, and that's where the destruction's taking place.
And since these are so prevalent in the body, destruction could be taking place anywhere, basically.
Absolutely. So we know that these ACE2 are highly prevalent in the oral cavity, right? Located in the epithelial lining of the tongue, the cheeks, the salivary glands. These COVID-19 pathogens have this spike-like protein on them, okay? That's right on the surface of the cells. And this little spike is actually attaching to these ACE2 receptors, and it's fitting these ACE2 receptors when you talk too much, which I love to do.
When you nerd out too
When
hard.
I nerd out too hard. Oh my gosh, I'm so excited about this. I love bringing this great information too, because I really want people to take this information and expand it out. And so other people can learn. So back to this. So COVID-19, these pathogens, like I said, have this little spike-like protein on them. So they're latching on, just like a glove or a lock and key, to these ACE2 receptors. What it's doing is it's weakened the immune system. And in an altered or weakened immune system, as in the case of this COVID-19 virus, these receptors are losing their function. I know I'm sounding repetitive, but we're getting this point across. They lose their communication. And instead of being anti-inflammatory, they're now pro-inflammatory. And this homeostasis is completely just thrown off.
Yeah, and I think that's really important to emphasize because this is it's starting in the oral cavity and it's spreading throughout your body.
Right. So what's happening is these ACE2 receptors, because they're losing their normal function, they're dysregulated. And they're releasing these toxins called cytokines. So these cytokines, I know.
What is that?
Oh my gosh. She's like, here we go. We're getting deeper.
I'm learning a lot of new words today.
So cytokines actually, in a normal, healthy, functioning body, do actually help aid in invading foreign pathogens and actually act as a normal anti-inflammatory. However, when there's disruption, dysregulation, homeostasis is thrown off, your immune system suppressed, these cytokines lose control. And they create, hear me out, this is a fun word, a cytokine storm.
Doesn't sound great.
Well, it doesn't. This storm of confused cytokines will actually increase inflammation anywhere these ACE2 receptors are in the body. Inflammation anywhere in the body generates destruction to healthy tissue and healthy cells. That's it.
Yeah, definitely.
Bottom line. It's so sad.
It's just crazy that, these little cytokines could do that much damage.
Mm-hmm. Absolutely. All you need is a little something throwing it off.
And you could be just completely crazy in your body.
Right. I think what we'll do now is now we know how the COVID is latching on to these ACE2 receptors, these cytokines, and all this destruction. So let's talk a little bit about back to dry mouth, loss of taste, loss of smell, and where this kind of comes into play. Are you following this? I'm
definitely following this, and I'm excited to actually, I feel like you just kind of gave us the background on COVID latching, and now we're going to get really into the oral health aspect.
Right. So when COVID-19 virus enters the oral cavity and attaches itself to these ACE2 receptors, remember, located in the epithelial lining of the cheeks, the tongue, the salivary glands. I'm saying this repetitively because I want it to sink in. This is causing salivary dysfunction and dysregulation of the normal salivary glands. When you have dysregulation and dysfunction of your salivary glands, saliva production goes down, you get dry mouth.
Yeah, and as we said earlier, dry mouth isn't normal.
Nope.
whether it's coming from COVID or dehydration or medication, you need to definitely address that with a healthcare professional.
Absolutely.
Because you should not be constantly experiencing that.
Especially now, COVID-19 is so prevalent and so relevant in topic everywhere. Most everybody knows the dry mouth, the loss of taste, the loss of smell. But now everybody's kind of learning why and how. So if you do start to notice you have dry mouth or loss of taste or loss of smell, it could be like a light bulb going off like, whoa, wait a minute.
Yeah, and I think it's important to note, dry mouth has a variety of symptoms.
Sure.
You might not have a dry mouth, but you could have difficulty chewing, difficulty speaking, dry throat, dry tongue.
Your cheeks could stick to your teeth. Like, we know all these great functions of saliva. And on top of it, when you have dry mouth, you are more susceptible to more foreign microorganisms because you don't have that first line of defense built up as you should with a normal salivary flow.
Exactly. And it makes you more susceptible to oral diseases.
Absolutely. Gingivitis, periodontal disease, oral lesions, you name it.
Yeah. So it's important to address no matter what, but especially in the case of COVID.
I agree. So we'll get into a little bit of the loss of taste and this altered taste as well. This is a fancy word for loss of taste and altered taste. You know what it is?
Dysphagia.
Excuse me, how did we know this, Meg? You're so smart.
When I lost my taste and my smell, the first thing I did was hop on Google. Yeah. Obviously, I think that's what a lot of people
Sometimes it's like, is that good or bad?
I know, self-diagnosing.
I know, right?
I think people are curious as to why.
Right.
I knew it happened and I knew, hey, that's probably a sign that I have COVID.
Sure.
But why is that occurring? And when is it going to end?
I know. Right. So yes, good for you. You get a cookie because you knew the word dysphagia. You go, girl. I love this. So remember how I told you saliva has a taste receptor called that taste int?
Yes, and I knew we were going to come back to this.
Yes,
so
you did.
Here we are.
So this taste bud receptor will decrease because remember how I told you that taste int is stimulated in saliva when it's mixed with saliva?
Yeah, and that's what gives you your taste.
Right. It's where your taste buds get stimulated. So if your salivary flow is low because you have dysfunction and dysregulation of these salivary glands, that taste bud receptor is going to be less because you don't have as much saliva to mix with it to stimulate the taste buds. So that's where that loss of taste is coming in. And I want you to remember this one thing too. These taste bud receptors are attached to nerve cell endings in the gustatory complex. This complex is located in your brain. We're going to come back to this because I want to kind of bridge that gap as well too, why maybe some people are having long-term loss of taste. Okay?
Yeah, definitely.
So we'll get back to that.
And I also just wanted to kind of add on to what you're saying. We talked about dry mouth and loss of taste and loss of smell.
Yeah.
A lot of people are experiencing these symptoms first.
Right.
And my question is it because it enters your mouth and your saliva, and that would be the first symptom you would experience because of that?
Well, look at it this way. Remember how we talked about your mouth as the first line of defense?
Yeah.
Where is COVID entering first and foremost?
That's true.
Right? Either your nasal passages or your oral cavity, right? And these ACE2 receptor enzymes are so highly prevalent in the oral cavity. That's why you're getting those very first symptoms. I like to call them prodromal effects because it's that first indicator something's off and that a foreign pathogen has entered your system.
Given what we just discussed with that, this is how COVID-19 affects your oral cavity. Then.
Yes. And I want to just touch on one more thing because you're so engaging and I love this. The other thing I want to touch on is the loss of smell, okay? The impairment of the olfactory gland receptors. So your olfactory gland is basically your sense of smell. So the loss of smell where these ACE2 receptor enzymes line the nasal passages, your olfactory glands and gustatory glands pretty much carry the same kind of neurological receptors. And a lot of times if you have loss of taste, you're going to have loss of smell. They kind of usually go hand in hand because they're directly related. They both use the same types of receptors. So if one sense of smell is not functioning, the sense of taste may also not function as well.
Yeah, and I think we can think of that in more just everyday terms. You know, if something smells better, you are a lot more inclined to want to eat that and taste it.
Right.
Whereas something smells bad, you might be turned off to taste it.
So to share something with you personally, she's like, thanks. I actually had COVID-19 back in January of 2021. And I was quarantined and out and about, by myself for a good probably 16 days. And for the first 2 weeks, I didn't want to eat anything because I didn't have that sense of smell and that sense of taste. I didn't want to eat. And I think that's where actually a lot of my weaker symptoms came in, because I just wasn't hungry.
I completely agree, and that caused me more symptoms, because I didn't want to eat because nothing was appealing to my taste buds or my smell. And that leads to fatigue and weakness and, all these other symptoms we see with COVID.
Right. So yeah, I mean, like I said, we just talked about this and how COVID-19 is affecting the oral cavity, right? So we talked about this. So this is your very first indication that COVID-19 virus may have entered your body. And I say may very lightly because we can't assume that, yes, that's it. But that is a huge indication that you may have COVID-19 or COVID-19 has entered your body. When it comes to your oral cavity, inflammation will increase if COVID-19 has attached to these ACE2 receptors, because remember, it's throwing off the homeostasis of these ACE2 receptors. So what will happen is lower salivary flow, you're going to have a little bit more or a lot more plaque in your mouth. This is going to increase your risk for oral diseases, periodontal disease, gingivitis, like I said, sores, things like that, lesions in your mouth.
Yeah, and for people that are already experiencing those things,
Right.
This makes it worse.
Sure it does. So the inflammation from these ACE2 receptors, reduction from the COVID-19 virus attaching itself to this enzyme, will alter the function of those salivary glands like we talked about before. It's where the dry mouth is going to come in. The reduction of taste because of that tastant is going to be reduced because you don't have as much saliva. So these ACE2 enzymes are also in the lining of your brain tissue. Okay, so the gustatory and olfactory sensory organs are in the brain. So if the ACE2 receptor enzymes in this epithelial lining of the brain have been impacted by the COVID-19 virus, this may be the result of long-term taste, long-term smell, and may take some time to get back to a normal function and production level. However, in extreme cases of the COVID-19 virus, people have reported symptoms from altered taste, loss of taste and smell, dry mouth, where it's become dormant and sometimes permanent. So that's where that comes into play.
Yeah, I can definitely relate. Almost a year ago, and I still don't fully have either back. So,
really?
I get really excited when I can smell a new thing.
She's like, oh, it's coming back, yay. So, this is super important for people to become aware of these symptoms, okay?
Yes.
As you can see, having a healthy salivary flow is essential for your overall and stomach and oral health. Most viruses that enter the body enter first through the oral cavity. We've talked about this. When we have an altered loss of taste or smell or dry mouth, this should, and I stress should, increase your awareness to set off a red flag that COVID-19 may have entered. So again, I know I keep sounding redundant, but I'm really trying to just bring that home, just so people are really getting that. Something's off in your system. That's all.
Yeah, and I think it's important to stress as well, we are discussing COVID, but healthy salivary flow is essential for maintaining your systemic health
Always.
when it comes to any virus or bacteria.
Absolutely. And people, we take it for granted because, again, it's subconscious. We don't think about our saliva. Oh, is my saliva production up today? Who thinks like that? Nobody does except for people like me.
Yeah,
Right.
it's like walking. You don't think about it.
It's all subconscious. However, being aware of your system and being aware and cognitive of we're in the middle of a pandemic. This pandemic might be here for a long time. We don't know. We need to be aware of our body. We need to be aware when something is off and recognize, wait a minute, I don't feel the same, or my mouth's been dry for a couple days, or wait a minute, food's just not tasting good. Something's off. Be aware.
Yeah, so let's kind of, dive into that a little more.
Okay.
What does this mean for your oral health?
So, to be quite honest, maintaining optimal oral health is critically important. Gaining awareness, such as topics like these that we're discussing, can significantly impact the quality of your life, okay? Dry mouth symptoms need to be addressed with your dental professionals. Routine checkup and cleanings are necessary, especially during a pandemic where viral load is high, right?
Definitely.
Right. So proper plaque removal with brushing twice a day, flossing, as well as using oral antimicrobial rinses are necessary. Reduce foreign microbes in the mouth. That will provide a healthy oral environment and decrease the presence of pathogenic microorganisms. So dry mouth allows these pathogens to adhere to the oral cavity and create destruction and disease in the mouth. If you recognize your mouth is dry, use an oral rinse that has an antimicrobial property, as well as dry mouth sprays as well, just to keep that stimulating moisture in your mouth, because it's so vitally important, especially during a pandemic.
Yeah, and it's actually funny you mentioned dry mouth spray. That was something I discovered during COVID when I had my dry mouth.
Really?
Yes.
Did it help?
It did.
What'd you use?
I found this one. It contains hyaluronic acid.
Cool.
And as you said earlier,
Yes.
Saliva also contains hyaluronic acid.
Can I tell the lady listeners about hyaluronic acid? It's good so we don't get wrinkles too.
Yes, and it's great for keeping your mouth moist.
Yes.
So this spray is called Lubricity.
Cool.
It was amazing.
Awesome.
And,
Did you have to do it like every day, or how often did you use it?
when I had COVID, I was doing it, kind of as I needed it, about, 3 times a day.
Okay.
And, now I don't need it anymore as that symptom has gone away.
Sure.
But I think addressing it when you have it is so important.
Absolutely.
To prevent, as we said, it growing into an oral disease.
Sure.
Or chronic dry mouth or anything.
In this product that you're speaking about, Lubricity also has natural antimicrobial in it as well. It has xylitol in it. That I do know. And xylitol is great to reduce that bacterium load as well in your mouth. That's awesome. I'm glad that worked for you.
It helped
Good.
make up for the dry mouth.
Awesome. Kind of switching gears a little bit. We talked about the correlation and everything. So let's talk a little bit about what this means for our overall health. Okay, because we did talk about oral health. I like to also bridge in that systemic health as well too.
Kind of tie it back to the systemic health.
Okay, so this is where the COVID-19 virus can greatly impact people who are already medically or immunocompromised, especially with people with kidney, heart, and lung diseases, okay?
And like we mentioned earlier, those are the people that are already immunocompromised.
Right. They don't have that awesome, super strong immune system as it is. So COVID-19 can actually do more destruction, unfortunately.
Yeah, definitely.
So when ACE2 enzymes, we're all going to be saying ACE2 enzymes, is altered because the virus is occupying these ACE2 receptors, individuals with other systemic diseases may be more susceptible to a severe form of COVID-19. Reduction of these ACE2 functions will increase susceptibility to inflammation. Like I said, anywhere that there's that epithelial lining, it can create cell death and organ failure, especially in the heart and lungs. When these ACE2 enzymes are altered because of the COVID-19 attaching to them, like I said, it's going to increase inflammation everywhere. COVID-19 migrates and moves systemically in the body through tissue migration and blood serum. So it goes to the lungs, the heart, the kidneys, the brain, and attaches to these vital organs and increases inflammation and destruction.
And especially in the lungs, this is where the breathing problems are coming in.
No, it's sad. My oldest son has asthma, and of course, as a parent, I worry about him every day. So yes, the lungs are definitely the focal point. Researchers are focusing on 2 points of contact where these ACE2 receptors are highly prevalent and where they're causing most damage. The lungs and the heart, for sure. So the lungs are the point of focus due to the loss of function of these ACE2 receptors in the epithelial lining in the lungs. So what's happening is it's destroying this alveoli tissue and reducing blood oxygen levels to a very critical low level. That's why people are on ventilators.
Yeah,
Sad.
and that's scary.
When it comes to the heart, the virus also is affecting the heart because it's creating inflammation and damage around the lining of the heart and can actually cause myocarditis, which can be very deadly. So this is a very, very, very difficult topic to talk about. Unfortunately, it's not a fun one, but it's relevant and it's important and it's imperative this information get out. What I also just want to say really quick is everybody's stress levels have been up for the last couple years.
Oh, yeah.
We all know that, right?
Can relate.
So, no kidding. So immunosuppression is experienced globally due to the psychological factors resulting from this pandemic due to the increased stress and anxiety. I don't care who you are. Everybody's been impacted by this virus in some form or way. So this, in and of itself, stress, can actually create salivary dysfunction due to a weaker immune response. So if your immune system's lower, everything's off, right? You don't have that natural homeostasis. Stress is a huge contributing factor to your immune response. It is. We all know that. So stress may actually weaken the immune system and make you more susceptible to infection. So, everybody, make sure you're getting proper rest and exercise, as well as eating nutritiously. Get out there, do some yoga, do some meditating,
read a book,
take some walks in nature, as I did the other day and rolled my ankle twice, by the way.
You should stick to the reading a book, I guess.
I know. No, but, it is what it is. It was worth it because it was a beautiful, crisp day. I loved it, even though I fell. So anyways, being out in nature, kind of pulling yourself away from so much stress that we all are under. Try and just pull yourself away so that you really can take care of yourself. And at times when many of us are choosing to be stagnant and roofless, the message that exercise is medicine is needed now more than ever. Exercise, I found this out. This is actually a great fact. Exercise may actually help lower the risk of COVID-19 infection and minimize the cardiopulmonary sequela. Hear me out. So that basically just means it's like secondary issues like to the heart and the lungs because of a virus, okay? So exercise actually can reduce you having a more severe form of COVID-19. And I did my research on this because I want to address this whole exercise thing. So cardiovascular health enhances the resistance against the COVID-19 virus too. So it actually boosts up your immune system, makes you stronger to fight against foreign pathogens. And it also aids in assisting in maintaining normal blood oxygen levels. And that also is what the ACE2 receptor does. It gives us this extra boost. So cardio exercise is like a boost for these ACE2 receptors against COVID.
As well as against, a lot of other things. Right. Exercise is never bad for you,
No. Who says it was? I want to know the researcher who says that. So anyways, in conclusion, researchers have now made saliva a biological marker for diagnostic testing for the COVID-19 virus. Saliva has a high virulent content. We know this, first line of defense, right? So saliva represents a systemic status for detecting viruses and diseases. It is considered minimally invasive testing, economically inexpensive, and has a 92% positive accuracy rate for COVID-19 results.
That's amazing news.
Isn't it?
Yes.
It's nice.
Yeah.
It's like almost like a quick swab, especially for kids.
Yeah.
Nobody wants
Those
that.
nose swabs are not too pleasant.
Yes. Sorry. Yes, they're awful. So anyways, it's time for people to start pay attention to their mouths, the changes it goes through, and please become aware of symptoms of dry mouth, loss of taste, smell. Maintain good oral health. Your mouth truly is a mirror to the rest of the body. Take care of it, guys. It could save your life. I mean, truly.
Yeah, and like we said, your mouth is the first indicator that anything has entered your body.
Right.
So paying attention to your mouth can ultimately help your systemic health.
So pay attention to your mouth is like paying attention to your body. And guess what, everybody? It's one system. Your mouth's connected to your body. So on that note, my friend, you're my friend now. I feel like we just spent an hour together. You're my new friend. We'll go out for lunch. Do you have any questions?
I actually do. There's so much knowledge in here.
Right. Did you feel like you got anything? Because I just want to make sure. Like, did you learn a lot?
Yes, I loved the connection to your oral health because
Thank
oral
you.
health is important in anything.
Yes.
And especially against foreign viruses and bacteria.
Yes. And I think it's phenomenal that the more people I talk to on how I'm trying to bridge that gap, I've talked to a lot of dentists, I've talked to some doctors, and they're like, you know what? We're starting to do that as well. I spoke to a dentist who's actually creating his dental practice to focus mainly on oral and systemic health. So he's not only there to improve your oral health from a dental standpoint, he's also there to help your systemic health. It's all one. And this is great news.
Definitely.
Right?
Yeah, that's awesome.
Yeah.
So kind of going back to what you said about these ACE2 enzymes being in the brain, does COVID increase your risk of stroke because of that?
So you're asking me, can COVID-19 increase the risk for stroke? That's actually a good question. And I did read something on that. So not only does COVID-19 infection create inflammation throughout the body, we know this, right? I've beat this in everybody's brain. We all know this. But it had also been known to produce hypercoagulation of the blood. That means reduce blood coagulation. And this may actually increase your risk for stroke.
Yeah.
Yeah.
That's crazy.
Sure. Scary.
And then going back to kind of how I said I used a dry mouth spray when I had COVID.
Yeah.
Do you think that using, a mouthwash or a spray or a rinse would decrease your risk of COVID-19 entering the oral cavity?
Absolutely. You're talking to an oral health nut.
I forgot.
What do you think I'm going to say? No. Of course, yes. Prevention of viruses and infections is key. And this is what I say. I always say this to my patients, being proactive instead of reactive. Be proactive. Take care of things so that you don't have to be reactive,
Definitely.
right?
Yeah.
So when it comes to your oral and systemic health, oral rinses, oral sprays will reduce foreign pathogens in the oral cavity, and they're recommended to be used routinely for optimal results. Another thing that I had discovered, which I thought was kind of cool, is a lot of people are doing probiotic rinses, which is great. So that actually helps keep normal, healthy flora in your mouth and will also help reduce foreign pathogens. So, Maggie, do you have any more questions for me?
I don't think so, but thank you so much for having me and sharing all of your knowledge on saliva and the correlation between your mouth and COVID.
So I have a question for you.
Okay.
Okay, Maggie. So are you almost 100% back to taste, normal smell? Like, because you had it when?
Last November.
Okay.
I wouldn't say fully back.
Okay.
It's kind of strange. If something's close to my nose, I can smell it.
Sure.
But if I was to walk into, a restaurant, I couldn't smell like an aroma.
Right.
So it's very strange.
Or like go to the fair and smell fried food.
I don't get those little pleasures in life anymore.
Oh, I'm so sorry.
But yeah, my taste I think is back more than my smell.
Good.
But like I said, some things just don't taste the same to me anymore.
Sure.
I had a nice glass of apple cider a few weeks ago because I was excited for fall.
Sure.
And I took a sip and it was absolutely disgusting to me.
And normally it's like so sweet and refreshing.
So it's weird.
Yeah.
I don't know a better word to describe it than weird.
I'm sorry. I honestly have to say as well, like I said, I had COVID, but it was much more recent. It was January 2021. I still have slightly dry mouth, and I do still have slightly loss of taste. I still struggle with that a bit.
Yeah.
Yeah. And I think, unfortunately, most of us still are because of just how impactful and destructive this COVID-19 virus has become.
And how long lasting it is.
Yep. And again, a lot of that has to do with because there's that epithelial lining in the brain, so if it's impacted those areas where all that is produced, the salivary gland production, the smell, the taste, things like that, it's going to just take a little bit longer. So I'm really hopeful that you're going to get all of your normal things back. And for all of you listening, thank you so much for tuning in today.
And thanks for sticking with us.
Yes, thank you so much for sticking with us. And please, 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 if you like this podcast, please share it with your friends, like it, and join us for our next cool topic when we will address more oral and systemic health.